My name is Jill Bray-Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm talking with Jonathan Billings. He's NMC's Vice President of Community Relations and RiseVT. And we recently completed a community health needs assessment, and Jonathan's going to be talking to us about that today. So thank you very much, Jonathan, for joining us.
My pleasure. Always fun to be here on the show, and this topic in particular is really important, so I appreciate the chance to talk about the needs in our community.
Yeah, and you've done a wonderful job shepherding this through and involving so many to really get a true accounting of what's important to the community. So thank you for taking the lead on this and pulling it together, because it's not as easy as it sounds, right? To be able to do this easily. So it takes a lot of work and thought. So.
Yeah, it's quite a process. And as you say, it involves many people and many perspectives to find that right balance, especially as you try and identify priorities.
Yeah, so you've been on the show a few times, but just in case there's somebody out there that really doesn't know who you are, or maybe how long you've been at the hospital and what you do, let's start there, and then let's jump into what is a community health needs assessment.
Sure. So my role as Vice President of Community Relations in RiseVT, it's a role I've enjoyed for 29 years now, and so I have seen many iterations of the assessment come through as our community needs have evolved. My role at the hospital is to really help keep the hospital connected with our community through our community relations, our communications, our marketing, our strategic planning, but also through prevention, our primary prevention work, the work of RiseVT to help the community embrace healthy lifestyles and make sure that here in our community, the healthy choice is the easy choice. And again, that all flows from the data within the community health needs assessment. So this is kind of a foundational document for us.
Wonderful. Now tell us a little bit about the Community Health Needs Assessment.
Sure. The Community Health Needs Assessment is a formal look at what are the health priorities in our community. And it's actually driven these days by a federal requirement. Okay. The government requires that all not-for-profit hospitals do a formal Community Health Needs Assessment. As I said, our history with Community Health Needs Assessment goes far back to partnerships with the United Way, with Northwestern Counseling, with Franklin County Home Health, with the Health Department. Yes. Franklin Grand Isle County have had long-standing, long before mandates, interest in making sure we were working on things that mattered in our community. And the Community Health Needs Assessment is a scientific way to really look at the data and look at public input and perceptions and make sure that you're focused on top priorities for the community.
So do you call people? Do you meet with people? How do you get this input? Yeah. What's the process look like?
The process ranges through various levels of input. We start with deep data review. We look at hospital data. We also look at a lot of data from the Vermont Health Department. We're very fortunate the Health Department has wonderful data for us to look at so that we can see incident rates, we can see comparisons with other Vermont communities. But through Quorum Health Resources, the management company that the hospital has an affiliation with, we're able to tap into their expertise, and we're pulling data from the Centers for Disease Control. We're pulling data from the Claritas data system. We're pulling data from IBM Watson that people see commercials on. Yes. So truly big data is flowing into this. And that's a very quantitative look at this. And then it turns qualitative. We do it's a non-scientific, but it's an online survey of the general public where we're in the media and on social media inviting people to share their thoughts with us in an organized fashion, a survey. And you can see what's on the community's mind, what's mattering to the community, and you compare that with the data. And then we assemble a group of community experts, about 60 people, broad range of representation across social services and healthcare and education and law enforcement and advocates for specific populations and general patients, just our general population. A group of 60 folks who come together and look at all of this data in summary and do some ranking for us and help with the prioritization.
Wow.
Because every issue that's out there touches someone.
Absolutely.
But in this process, we're looking to narrow down some focus to create real strong partnerships so that we can address things that are really pressing in the community.
Wow, fantastic. So What are the results?
The priorities this year identified 7 pressing priorities in our community. And they're somewhat familiar from 3 years ago. Some things have moved around as a lot of good work has been done. Our top 2 are mental health and substance abuse. And those show up both through our statistical data and their tops on community minds and feeling like priorities for folks.
Yes.
And whether that is accessibility of services, whether it's treatment, or whether it's prevention, it's a broad range of focus that drives this to the top to say that we really need to be attentive to the mental health of our community and the use of substances in our community. And substances range everything from opiates to alcohol. We can't forget alcoholism in our community. There are other substances that people turn to as well. And so it's a broad topic. And then obesity comes in as the 3rd pressing priority. And you'll see farther down the list in the areas that didn't bubble to the top are ramifications tied to obesity, things like diabetes and heart disease and stroke and cancer. And so it's really important for us to be looking at healthy weights in our community so you can prevent these other things that are more frontline concerns. But within our assessment, obesity was the topic that came to the top and said, if we could touch this, you could touch so many other things. And then the next 2 are suicide and domestic and sexual assault. And these are things that are at times less in the spotlight in our community, but so impactful when they happen. And they do happen. And our rates show it. Numbers are small, and so as you look at percentages, they can vary. But our expert panel was very clear. Any of this is too much in our community.
That's right.
Any suicide, someone taking their own life, is just too much, and we need to be out there with services to help folks who are thinking of terrible things, and we need to be way out in front with engagement and activities and helping people find hope and employment, etc., so that you can prevent these things.
Exactly.
And so that's a real emphasis. The new priority this year is our 6th priority, and it's not new to the community, it's new to our list. It's food insecurity. And so it is a recognition that there is hunger in our community, and there's malnutrition. There are areas in our community where people don't have great access to healthy foods.
Right.
A gas station might be their only grocery store, and it's just it impacts how you eat. Economics impacts it. Our food shelves are remarkably busy. They are a gift to us to have these programs. But as you look at the utilization, you understand that hunger and food insecurity is so widespread. It impacts our children. And so that is a priority for our community. And then the final top priority for us this year is smoking and vaping. And it was higher on the list 3 years ago, and it has come down some, and that's partly a community reflection of understanding that our cigarette smoking rates have come down and come down nicely over the past 10 years. And we feel really good about that. But at the same time, in the past 2 to 3 years, vaping has come onto the scene, the use of electronic cigarettes, and you'll see things called Juul in your mini marts, and they're not over here with the cigarettes behind the counter. They're right up front where our kids are shopping and seeing them. And there's a misperception that vaping is healthy when it's actually just another device to become addicted to nicotine. Personal opinions, but there's real health concerns around the chemicals in that vapor and the addictive nature of it. And so we felt even with the gains that we've made with cigarettes, it needs to stay a priority. We need to be out there, particularly with our youth, but with our adults as well, and helping folks understand that this is driving lung cancer. This is driving many other forms of health problems. It's driving healthcare costs, and it's absolutely preventable. And so those 7 priorities give us a real focus, not just as a hospital, but as a community, on if we wanted to truly embrace a healthier future and have a healthier future, these are things we need to be working on.
Now, how do the how does the hospital and the community partners use this data now?
This becomes foundational for various organizations planning. Before it was done, we were already getting phone calls from excited community partners who wanted the document for grant writing to be able to shape the programming they offer, but also shape their requests for funding to make sure they're focused. When we first rolled it out, the hospital board brought in the boards of the Franklin County Home Health Agency, Northwestern Counseling and Support Services, and the Notch Rural Health Clinics. So the boards and leaderships of those 4 major healthcare organizations came together to hear this and do some shared planning, because any one of these topics is bigger than the hospital. It's bigger than any one agency. It's bigger than any sector. The magic of this is when people come together and collaborate and work together. So the document is now out on our website. You can see the summary PowerPoint.
So anybody can see it.
Open and free to the public.
Okay, great.
Community partners can download it. We've got printed copies at the hospital if folks don't want to go through the computer system. But it becomes a document because 3 years from now, we are intending to look back and see that these indicators that we have identified are hopefully changing. Some of the indicators take many years to change, so we don't anticipate those to move. But there are leading indicators that tell you you're on the right path. And we need to see those leading indicators headed in the right direction so that we can feel that it's one thing to measure priorities and identify them. The glory, the real magic of this is improving the health of the community.
Yeah, that is so very, very true. So what's the expectation of this document and what we do with it? Do we have to put an action plan together? What's the requirements now?
Yeah, within the federal requirement, they actually require nonprofit hospitals to put together an action plan for 3 years. Hospitals are allowed to pick and choose among the priorities to say this is relevant, this is not relevant to us. Our leadership team, our board, our medical staff have always looked at these priorities and said they're all relevant to us. Whether or not the hospital is the primary driver and partner in it or not, we've always felt we should have some role in this. So as you look at our action plan, which is online as part of the document, you'll see that some of these we are right out front. And our treatment services are a big part of how we address these. Our prevention services through Rise Vermont and Lifestyle are a big part of these. And in others, we're a supportive partner. We're helping behind the scenes. We're helping fund some initiatives. We're learning from our partners who have more expertise. So our action plan varies depending on topic, but it's all looking at here are the identified indicators that we put together that we want to improve. How do you do that? And so all of those action steps are there. And a lot of emphasis on prevention, that it's not just how do you treat these things, but our medical system's evolving, our partners are evolving, and people are really thinking, wait, it'd be so much better if we prevented this in the first place. So you got to do both at the same time.
You do. So is our results similar to other places in Vermont? Probably we don't all do it at the same time. I don't know, but
it's funny because I grew up in Vermont, and each Vermont community thinks it's absolutely unique, and we're fiercely independent, and we like local control, and I am all about all of those. But we have, in the past, gathered all 14 community health needs assessments and lined them up and just looked to see how common are the themes, and it's very common. And actually, it extends beyond Vermont. Mental health and substance abuse is a concern in other parts of the country as well. I think each community is unique in terms of their rank ordering, what they're working on at that moment, what they're already strong at that might be a priority but doesn't show up on their list because they've already tackled that and they've got good momentum there. But the heart and soul of it is very similar. If we were embracing healthy lifestyles and really taking care of ourselves and investing in ourselves, it's all the same sort of thing that helps with this. And then the results of these topics are familiar across Vermont. 600,000 people in some states, we're a suburb. Here we're our own state. So everybody's got their own nuance, but there's commonality, and we can learn from each other and share best practices. And that's one of the exciting things about both the work the Accountable Care Organization is doing for hospitals and statewide Rise Vermont is doing as Rise Vermont moves throughout Vermont communities, is we're not reinventing the wheel as much anymore. We're learning, they're doing great stuff in Bennington. They're doing great stuff in St. Johnsbury. They're doing great things in Rutland. We're doing great things in St. Albans. Let's share for the greater good.
That's terrific. So I can feel your passion about all of this. As we sum up our time together, what are you most proud of, even if you reflect from the last one to this one and our progress as a community? What strikes you about this?
I think that change is possible. One of my heroes in public health, a dear friend and advisor of yours, is Con Hogan, a state leader. And
yes.
Con looked at things over time. He looked at lead poisoning in Vermont that 30 years ago, 40 years ago, was a deep priority. People worked on it, and it's still a concern, but it is in far better place than it ever was before. We've seen smoking change. Access to primary care used to be a concern,
right.
and that's improved locally. And so things can change, and that's what I'm most proud of. And then the other piece that I'm proud of is the partnership spirit, the fact that my hospital colleagues can see that we need partners and that we're willing to work with folks and willing to work on prevention, that it really is a community project. It's not something that's just going to sit on a shelf. We're going to work on this.
Wow, what a great way to wrap it up. I love that. Well, thank you so much. And I know as the action plan moves forward, we'll probably have other discussions that we could have on the show. But thank you so much for your work on this, for reporting it out and making it so accessible to the community so we can all wrap around this. As you said, like we're one community. Great. We're in this together. Thank you so much.
My pleasure.
I'm Jill Bray-Bowen, the CEO of Northwestern Medical Center, and your host today, and talking about community health needs assessment. So go to our website and take a look, or you can come in, and we'd love to see you too. We have hard copies, it sounds like, to share with you, so that we're all in this together with our community health needs, so that we're working for the overall well-being of our communities that we serve. Thank you for joining us today.